Good afternoon, ladies and gentlemen. I'm here to discuss surgical versus non-surgical fracture treatment and how to use evidence-based decision-making with our patients to ensure that we make the best choice for them in the long run when it comes to treating fractures. The fracture treatment dilemma. Fractures can often be quite costly for both patients and healthcare providers. They often uproot a patient's life and make them unable to participate in their hobbies or work. They also require extensive treatment and long-term care with multiple follow-ups. Treatment options range from conservative methods such as casting and rest to surgeries such as total hip replacements. Surgery is often the first choice of treatment for healthcare providers, but is not always the best choice for patients. The purpose of this review is to discuss the importance of including patients in our decision making and how effective non-surgical options can be when surgery is not the best option for our patients. All searches were conducted in the Jerry Falwell Library. Keywords searched were surgical fracture treatment intervention, non-surgical fracture treatment intervention, non-operative fracture treatment, non-invasive fracture treatment, and fracture surgical complications. And these were all scholarly works, peer-reviewed, and from the past 5 years. A study in the UK of 28,375 fracture cases came to the conclusion that only 2 out of 12 fracture types favored surgical intervention over less invasive treatment methods. More surgeries are being performed than clinically necessary. Often, healthcare providers will jump to surgery as a first option, and patients aren't always aware of their choices. Another study was also conducted of 122 clavicle fracture patients. Surgical patients had complaints of sensory deficits and were less satisfied with cosmetic results than patients who were treated with less invasive methods. Patients must understand the inherent risks of surgery and their alternative choices before consenting to a procedure. I think that is very important for patients to understand the risk before going into something. In another study with 765 patients with hand, arm, and shoulder fractures, no statistical difference in satisfaction, pain, and disability of the arm, shoulder, and hand score was found after surgical and non-surgical treatments. This means that surgery may not have been indicated, since surgery does come with higher risk, is more expensive, and can often leave cosmetic issues as well as a higher likelihood of complications. 32 patients with elbow fractures were followed for a study where 15 were treated surgically and 14 opted to be treated non-surgically, even though surgery was indicated for this type of fracture. The non-surgical patients actually did have better outcomes, as some of the surgical patients had complications. Sometimes surgery is not the best practice for certain patients who would not tolerate surgery well for a number of reasons, where non-operative treatment might be the best course of action on a case-by-case basis. The above evidence points to the fact that surgery may not be the best choice for all patients, but could benefit others. Therefore, it is the responsibility of healthcare providers to educate their patients properly and allow them to participate in their care with the evidence in front of them. As healthcare professionals, if we got injured and needed to go to the doctor, we would expect that our care provider would provide us with the most up-to-date and evidence-based care available and allow us to be part of the decision-making process. For that reason, it is important that we are not hypocritical, and we also allow our patients to participate in their care as well. In his Sermon on the Mount, Jesus discussed how we should treat others. He said, "So whatever you wish that others would do to you, do also to them, for this is the law and the prophets." This means that we should be treating our patients as we would want to be treated if we were in their position. In conclusion, each patient's situation should be individually considered when determining whether operative or non-operative treatment is the best course of action. Thank you.